All right, welcome back to another edition of our Go Live. Today we're going to talk about vertigo and dizziness and fall prevention. This is an area where, for me, when I was in physical therapy school, it wasn't until I was in my first year, at the end of my first year, that I realized that physical therapists actually treat or do something for vertigo and dizziness. I had no idea. I've been around physical therapy my whole life. My dad's a PT, been in and out of clinics my entire life. I had no idea that PTs do vertigo because it does take a little bit of additional training to be able to treat that. So after my first year, I had the opportunity to work and shadow at a place up in Utah at a hearing and balance center that exclusively treated vertigo, BPPV, or benign positional paroxysmal vertigo, as well as Meniere's and several other disorders regarding the inner ear organs of the brain that help with our equilibrium and our balance. So many folks will come in on their first day for vertigo therapy, or vestibular therapy as we call it. They have no idea or are shocked at what are we going to do in physical therapy about my dizziness? Are there exercises you can do for vertigo? And the truth is, yes, we see it very often. It's very, very common and luckily very easy to treat. It's not very complex. Physical therapy is very effective as long as you get the right diagnosis. Sometimes it's not clear because if there's an issue of what we call orthostatic hypotension or a drop in blood pressure when we change positions, like going from laying down to sitting up, if we get lightheaded or feeling like we're going to pass out or faint, oftentimes that's a blood pressure issue. Maybe the blood pressure medication is too high. And so when we change those positions quickly, our heart doesn't have a chance to quickly recover and profuse blood to the brain. What also will happen is when people will lay down and they have this inner ear disorder, what can happen is we roll over and we get this room spinning sensation. This room spinning sensation is a condition called benign positional paroxysmal vertigo, or BPPV. Often your doctors will tell you you have crystals in your ear. So if you have friends, family members who have told you they had crystals in the ear, that's what they're talking about. They're talking about BPPV. Very easy condition to treat as long as it's identified correctly. Very easy to do in clinic also because it's a couple easy clinical tests to see if there actually are little crystals or otoconia that are dislodged and floating in the inner ear canal that cause that fluid to shift more rapidly, and therefore a sudden change in that discharge from one side to the other, there's a difference, will cause that room spinning sensation, typically lasting seconds to minutes, and then going away. Now you can still feel like you've been on roller coasters all day long after that happens, so you feel kind of heavy-headed or foggy-brained, as many of my patients will call it, but the room spinning is gone. And so they'll be very careful not to tip their head to look under a sink or look under their car, or they'll be very careful as they're going to the hairdresser not to tip their head back. But often they'll tell me that when they're in bed, they roll over from one side to the other and the room will spin. And often it'll be on one side more than the other. So it's all about getting the appropriate diagnosis and identifying what's going on to get the right treatment. The other thing that we see a lot of is that the vestibular system, like all the other systems of our body as we age, will decline in function. They get worse. Our sensation, our taste, our vision, our strength, our motion, our balance, all these things decline. Our vestibular system is no different. So the sensitivity to motion can change, and it can change more rapidly on one side versus the other. And because the two work together, we can have a difference in that discharge that can cause some spinning or some dizziness. And it can be a little bit different than a BPPV condition. And that's treated a little bit differently as well. So getting the right prescription, getting the right identification of what's going on is hugely important to get the right treatment and overall the resolution. Because ultimately what we're trying to do is reduce the risk of a fall. Fall is a huge issue as we get older because our bones are a little more brittle and we don't recover as quickly. And so anything that we can do to help people recover from falls and avoid them altogether is something that we spend a lot of time doing. Hope that helps. Hope that answers a lot of questions. If you do get a referral for vertigo or vestibular therapy or crystals in your ears, please feel free to call in and inquire about anything else we can do to help you. Hope you have a great day.